So as hopefully many of you know by now, we do a lot more than facial cosmetic surgery. We actually have a full laser practice as well that treats a lot of different problems of both the face and body. So we get a lot of questions about what laser is good for what. They can be very confusing. There are a lot of lasers out there. A very common question is what lasers are good for red dilated vessels or brown spots, and which ones are good for wrinkles and fine lines. So let's talk about color.
Yeah, this is a pretty complicated conversation, and the best answer to this is obviously you want to come in and be evaluated and get a sense of what really is necessary. If it's sun damage that we're talking about, where it's years and years of sort of accumulated sort of brown spots that develop and sort of that darkness that comes with that, the coarseness of skin, then you're talking about resurfacing lasers like the Fraxels, the 1540 fractal laser that we like to employ. That can also help with some of the more superficial melasma that a lot of women develop post-pregnancy or just through life.
So really we're talking about darkness from sun damage.
Absolutely. So that's one way to look at this. Another thing then to look at is the red stuff that you deal much more commonly with IPL.
Yeah, so IPL is intense pulse light. There are other types of lasers that are specialized as vascular lasers also to deal with dilated blood vessels and other things. But intense pulse light deals with that and also just generalized redness. Flushing from rosacea or rosacea-related problems, redness and other color changes that can happen from sun and from hormonal changes too. And the reason it works is it's taken up at that wavelength that's in hemoglobin and red blood cells, and as well in melanin, the pigment that's in brown spots. So for color problems like that, the IPL works really, really well.
That doesn't mean that IPL can also be used for some of the sun damage. It's just a question of the extent. So a lot of women where it's just not really deeply entrenched, maybe an IPL is sufficient, and you've got to be a little bit more aggressive to kind of get some of that sun damage out. Sometimes a combination of using the fractal laser with the IPL, even at the same setting, works beautifully if you've got a little bit extra downtime. So the best way to sort of answer these questions is really to identify the problem, get a sense of what you want to do, and then set a plan. We're not the guys who would ever recommend doing full CO2 laser like back in the day, unless you're sort of really want to take 20 years off of your age and got a couple of weeks to look pretty dogged and meat-like. But that's just it's a great laser in that sense. But it has to be for select patients, and you just have to know what you want to accomplish.
Yeah, the thing to remember with lasers, you get in what you put in, you get out what you put in, and not all IPLs are created equal. So it's really important if you're coming to us or somewhere else that you really talk to the doctor, whoever's treating you, make sure they're treating you with the right type of IPL machine, the right power, fluence levels, and take a look at their results and make sure they're getting the kind of results you want.
Yeah, one last note, if you're any sort of person of color, so if you're Hispanic, Middle Eastern, African American, anything like that, this conversation becomes even more specialized. You really want to make sure you're talking to people who know how to deal with skin of color, because that has its own issues and ramifications, and not all lasers work in that category.
So long story short, come in for a visit.